When someone tells you that your reality doesn't exist, that's gaslighting. When they convince you that your pain is imaginary, that's manipulation. But when an entire political system does this to millions of people, what do you call that? In the past 2 years, LGBTQ plus youth experiencing suicidal thoughts jumped from 41% to 47%. Anxiety spiked from 57% to 68%. And this isn't happening in a vacuum. It's happening while lawmakers are systematically erasing our existence from legal documents, banning our healthcare, and telling us we're too dangerous to use public bathrooms. This is political gaslighting, and it's destroying our mental health in ways most people don't even realize. I'm going to show you exactly how this manipulation works, and more importantly, how to protect your mind from it. Meet Alex, 23 years old, trans-masculine, living in a state that just passed its 5th anti-trans bill this year. 6 months ago, Alex was doing okay. They had started hormone therapy, finally felt comfortable in their body, had a solid friend group. Life wasn't perfect, but it was moving forward. Then the bills started passing. First, their state banned gender-affirming care for anyone under 25. Alex's hormone prescription, gone overnight. Their doctor legally couldn't prescribe it anymore. The second bill restricted bathroom access. Alex now had to choose. Use the women's room, which matched their birth certificate but would expose them to stares, questions, and hostility because they looked male, or use the men's room, where they felt safe, but risk arrest under the new law. The third bill removed gender identity from all state anti-discrimination laws. Suddenly, Alex could be fired, denied housing, refused service, legally. But here's what broke Alex. It wasn't just the laws, it was the rhetoric around them. Politicians stood on TV and called people like Alex confused, mentally ill, a danger to children. They debated Alex's right to exist like it was a legitimate political question, not a human being's life. Alex started having panic attacks every time they checked the news. They stopped leaving their apartment, stopped responding to friends. Their therapist noticed signs of severe depression and PTSD, not from a single traumatic event, but from the constant, grinding pressure of being told by their own government that they shouldn't exist. Alex's doctor had a name for this: legislative trauma. And Alex isn't alone. Millions of LGBTQ plus people are living this right now. So what's actually happening here? How does political rhetoric cause this level of psychological damage? Let me break down the manipulation tactics being used. Because yes, this is manipulation, operating at a massive scale. Tactic number 1, institutional gaslighting. Classic gaslighting makes you question your own reality. Political gaslighting does the same thing, but through laws and official policies. When legislation says gender identity doesn't exist, it's not just a political opinion. It's the government telling trans people that their lived experience is invalid. When politicians claim LGBTQ plus people are grooming children, they're rewriting reality to paint victims as predators. This creates what psychologists call epistemic injustice, the systematic denial of someone's knowledge and experience. You know who you are, but the state says you're wrong. That cognitive dissonance is psychologically devastating. Tactic number 2, minority stress amplification. LGBTQ plus people already deal with minority stress, the additional strain of navigating a world that wasn't built for us. Discrimination, microaggressions, internalized stigma, these are constant background stressors. Anti-LGBTQ plus policies don't just add more stress, they amplify it exponentially. Research shows that when states pass discriminatory laws, LGBTQ plus people in those states experience sharp increases in anxiety, depression, and suicidal ideation, even if the law doesn't directly affect them personally. Why? Because the law sends a message: you are not safe here, you are not wanted, we are coming for you. Tactic number 3, anticipatory grief. Here's one of the cruelest effects: anticipatory grief. This is the trauma of constantly waiting for the next attack. Every legislative session becomes a threat. Every election could strip away your rights. You're mourning losses that haven't happened yet, but you know they're coming. LGBTQ plus people are living in a state of perpetual bracing. You can't relax, you can't feel safe, because you've learned that safety can be legislated away at any moment. This chronic hypervigilance is the same mechanism that causes PTSD. Your nervous system never gets to rest. Tactic number 4, structural violence. The term sounds academic, but it's brutally simple. Violence built into systems and institutions. When laws deny you health care, that's structural violence. When policies erase your legal identity, that's structural violence. When rhetoric dehumanizes you in the public square, that's structural violence. And unlike a physical attack, you can't escape it. It's everywhere, it's official, it's normalized. Studies show that this kind of systemic harm causes the same psychological trauma as interpersonal violence: anxiety attacks, dissociation, depression, substance abuse relapse. The law itself becomes the abuser. So how do you protect your mind when the threat is this big, this official, this everywhere? You can't vote it away tomorrow. You can't argue with it on Twitter. So what actually works? Strategy number 1, name it as abuse. First, stop treating this like normal politics. It's not a difference of opinion. It's systemic psychological abuse. When you name it as abuse, you stop gaslighting yourself. You stop thinking, maybe I'm overreacting. You validate your own nervous system's alarm bells. Your fear is rational, your anger is justified, your grief is real. Don't let anyone, including your own internalized voice, tell you otherwise. Strategy number 2, limit exposure without denial. There's a balance here. You can't stick your head in the sand. Awareness is survival. But you also can't doom scroll 24/7. Set boundaries. Check news once a day, not every hour. Mute political keywords on social media during mental health breaks. Give yourself policy-free zones, times and spaces where you don't engage with any of it. This isn't avoidance, it's damage control. Your nervous system needs time to regulate, and it can't do that while constantly processing threats. Strategy number 3, build micro-communities of safety. When the macro level is hostile, double down on the micro. Find your people, even if it's just 2 friends who really get it, even if it's an online Discord server. Create small pockets where your existence isn't debated, where your identity is affirmed, where you can exhale. Research shows that strong social support is the single biggest protective factor against minority stress. Community literally buffers your brain from structural violence. Strategy number 4, separate self from narrative. Here's a hard one. The political narrative about LGBTQ+ people is not about you. I know it feels personal because it affects your life personally, but the rhetoric isn't actually about your individual humanity. It's about power, control, and scapegoating. Politicians don't know you. They're not talking about you, the complex human being with dreams and flaws and a favorite coffee order. They're talking about a political abstraction. When you can hold that separation, this law is unjust versus I am worthless. You protect your core sense of self from the narrative attack. Strategy number 5, seek trauma-informed support. If you're experiencing panic attacks, depression, suicidal thoughts, please reach out to a therapist who understands minority stress and legislative trauma. This isn't something you should white-knuckle through alone. The Trevor Project, LGBT National Help Center, and trans-specific hotlines exist because this harm is real and you deserve support. Your mental health isn't weak for struggling under this pressure. Your mental health is responding rationally to an irrational level of systemic harm. Political gaslighting wants you to believe that the problem is you, that you're too sensitive, too dramatic, too fragile. But the data is clear. LGBTQ+ mental health is collapsing because the structural violence is escalating. This is cause and effect. Your pain is not a personal failing. It's evidence that you're a human being forced to endure inhumane conditions. And the most radical thing you can do, the thing that terrifies them the most, is to protect your mind, stay alive, and refuse to let their rhetoric become your inner voice. You are not the problem, the system is. Guard your mind. You deserve to exist, not just legally, but fully, freely, and without apology. Stay safe out there. This video is for educational and informational purposes only. It is not intended to replace professional mental health care, therapy, or crisis intervention. If you are experiencing a mental health emergency, please contact a qualified mental health professional or crisis service in your area.